Much indeed, ladies and gentlemen. Thank you for allowing us to come and present our project about world child cancer to you this evening. Now, one of the great medical success stories of the last 40 years has been this improvement in survival for children with cancer, from little expectation of survival to 75 to 80% survival, but only in wealthy countries. And that represents just 20% of children with cancer. 80% of those patients, the patients who get cancer, live in low or mid-income countries, and they usually die, often undiagnosed, with no treatment, no palliative care, no pain relief. And that inequality, we feel, cannot carry on. And so we tried to form an organization, World Child Cancer, and that came from the parents of cancer patients around the world and the professional group, and they formed World Child Cancer in 2007. And the aim of the charity is to provide targeted donor aid for a limited period of time, for 5 years, whilst we try to develop within the country of the resource-limited country, develop local sustainability. We try to raise the awareness of cancer amongst the medical profession and amongst the public in those countries. We try to improve earlier diagnosis so the tumour can be treated more easily. And behind me you will see some pretty gory pictures for some of them of young patients with enormous tumours. And we want to see the patients much earlier so we can really cure them. We want to increase the number of children treated on locally developed, affordable protocols. We want to improve the palliative and supportive care, because I've already mentioned that many people die with no pain relief and no treatment. We want to decrease abandonment of treatment, something I'll come back to, and we want to obviously improve survival. And each of our projects, we are applied to by the country that wants to develop the project. We set them to produce a project, and we give them aims and measures which we can then assess in terms of performance. In addition, we insist on strict financial governance. We have 4 projects that Suzanne has mentioned, but Ghana is our very next target project. This is a country which is politically stable, which has a population of 23 million. 38% of the population are under 15 years of age. Is 25% in the UK. They have reduced their under 5 mortality, childhood mortality, very significantly. They're not going to reach their Millennium Development Goal, but they are approaching it. We have a local leader who trained around the corner here in Great Ormond Street and in the Sick Children's Hospital in Edinburgh, which is my hometown. She is reliable. The challenge for them is the same as the challenge in most of the developing countries where we work. Poverty, local, community, national. The local poverty means parents cannot afford all the costs of treatment. In Ghana, we are lucky. The National Health Service and the ministry there pay for most of hospitalisation, but they do not pay for the cytotoxic drugs at the moment. We're working on them. The drug costs may be enormous. They are in Britain, but in Ghana they're not. 40% of the tumours that we treat, and you're seeing some of the pictures here, not that one, that's an osteosarcoma, but 40% of the tumours are a tumour called Burkitt's lymphoma, which can be treated and cured in at least 50 to 60% of patients using drugs that total cost are £600, which in our terms is a minimal amount of money. It's still too much for most Ghanaian families, but there are rich families, and we do operate somewhat of a Robin Hood principle within units where some people can afford more than others. There's also a lack of awareness in the community and a perception of incurability of cancer, which we have to overcome. There's a lack of trained staff. We have 1 single paediatric oncologist in Ghana, but 3 other paediatricians who help. But we're getting a girl going back from Toronto, who is Ghanaian, to join the team, which is great. We need to help them to retain staff. We also need to deal with transport infrastructure. How do you get from rural Ghana to the hospital for treatment? Can we do it nearer to home with satellite centres? If I tell you some statistics, 1,000 patients are expected each year in Ghana based on their population and their childhood numbers. 200 actually received treatment last year of some sort or other, 1/5 of the expectation. For each 100 that goes to Korle Bu, only 7 to 8% die very early, another 12% die early on in treatment, and we end up at the end of treatment with just 40 cases, of whom about a half live. There's a problem. We want to help, we want to raise awareness, we want to educate the public, we want to educate the doctors, but also the public, and we think you can help in that direction. We want to run campaigns of education. We want to produce a data registry in order to register every single patient that occurs. And there are many ways you can help us. We'll come to those in questions. Thank you.